Hey guys, I'm back with the summary of second part of my video book titled Dietary Management of PCOS. If you haven't seen the summary of the first part of V-book yet, then go and watch that. I'll be giving you the brief description of each chapter in this video. So let's get started. Chapter 1 is about the relation of Polycystic Ovarian Syndrome with infertility. When you are suffering from PCOS, hormones get out of balance and you experience menstrual irregularity. Ovulation does not occur due to high level of testosterone in the body. Erratic menstrual cycle starts, which means due to unbalanced hormones, menstruation and ovulation can be irregular. And ovulation problems are usually the primary cause of infertility in women with polycystic ovary syndrome. Another reason for infertility is underdeveloped uterus. Imbalanced hormones prevent the lining of the uterus to develop properly. But it doesn't mean that if you are struggling with PCOS, you cannot get pregnant. Let me give you good news. You can get pregnant, but you will have to make certain lifestyle modifications to get the blessing of being pregnant. I have given a detailed description of how infertility can be turned into fertility by adopting some nutritional guidelines and dietary regimen in the video box, so I would recommend you to watch that. Chapter 2 is about a correlation of polycystic ovary syndrome with metabolic syndrome. Do you know what metabolic syndrome is? It is the cluster of several disorders such as obesity, especially in the abdomen, increased fasting blood sugar and blood fat values, and high blood pressure. So how metabolic syndrome is diagnosed? For that, you have to see the chapter 2. There is a strong relationship between PCOS and metabolic syndrome. Metabolic syndrome affects 33% of women with PCOS. Patients with PCOS have featured metabolic syndrome, such as obesity, hyperinsulinemia, and insulin resistance. Women with PCOS have decreased basal metabolic rate and should restrict their energy intake through diet. A quite common question many females have: what happens if PCOS left untreated? The answer is in the chapter 2. Another very important piece of information I want to add in your knowledge is that polycystic ovary syndrome is related to the development of breast cysts or lumps. This condition is characterized by an imbalance in hormone levels. As a result, cysts or tumors may appear in the breast, in the ovaries, or in some other parts of the body. And a detailed topic of how PCOS affects the breast tissue is available in the book. Are PCOD and PCOS the same? A lot of women get confused between the two, often using the two terms interchangeably. However, there is a huge difference between PCOD and PCOS. Chapter 3 is about the difference between PCOS and PCOD. PCOS and PCOD is similar yet so different. How to know you have PCOS and not PCOD? Number 1 is irregular periods. Number 2 is high level of androgen. And number 3 is cyst in your ovaries. PCOS also affect adolescents. Many adolescents experience a shift in self-perception. This shift of their femininity and identity as a woman is due to the physical and reproductive symptoms associated with polycystic ovary syndrome. Adolescents with PCOS have jeopardized psychological health that can probably lead to psychological distress and impaired emotional well-being. A full description is in the chapter 3. In the chapter 4, I have discussed about the relation of polycystic ovary syndrome with hyperinsulinemia. Medical experts are still unclear on the real cause behind PCOS, but most women who are diagnosed with PCOS develop insulin resistance. Under insulin resistance, your body is unable to use the hormone insulin effectively, which leads to high blood pressure. As you can see in this flowchart, if your body is diagnosed with PCOS, it develops insulin resistance, and your body becomes unable to use hormone insulin. That leads to high blood sugar and decreases fertility. Do you know what hyperinsulinemia means? It means the amount of insulin in your blood. It is higher than what's considered normal. So what are the major functions of insulin? It regulates body blood sugar level and peptide hormone created by pancreas and released into bloodstream. And the primary purpose of insulin is to allow for your body's absorption of glucose. And then glucose enter in the bloodstream and absorbed by the cells. So if you are a candidate of PCOS, then your chances of suffering from hyperinsulinemia increased double-fold than the normal woman not suffering from this endocrinopathy. Now you can lower the hyperinsulinemia through adopting dietary strategies, such as follow a low-carb diet. Take apple cider vinegar. Taking 2 tablespoons of apple cider vinegar daily lowers the level of hyperinsulinemia in your body. And watch your portion size. Keep away from all forms of sugar. Taking part in ordinary active work can have incredible insulin bringing down impacts. As world is facing the pandemic COVID-19, do you know that women with PCOS are more susceptible to COVID-19 infection? And the reason is your hormones in this disease get out of balance and your immune system gets weaker. Moreover, you become a candidate to be affected by COVID infection. Detail is available how PCOS is a high risk for COVID-19. Chapter 5 is the last chapter of this video book, and it is the most important chapter of the dietary management of PCOS. Because in this chapter, I have added a diet plan of 1500 calories, including some PCOS-friendly recipes that can help you to reverse polycystic ovary syndrome. So this was the brief description of second part of the dietary management of PCOS.